According to World Health Organization, more than 210,000 cases have been reported and more than 9,000 people have lost their lives. Countries all over the world are putting up necessary measures to stop transmission and save life. In Kisumu, residents, business ventures and medical facilities are not leaving anything to chance. They are exercising caution.
I'm Dr. Shem Rakewa, a practitioner in Kisumu County. Now, we all know and are aware right now because the government has made this public and the president made a public press conference about it. COVID-19 is a disease that is now here with us in Kisumu and it is in Nyanza province. Currently, we are following a case, one of the 8 cases that was reported. We can confidently say that was a patient reported in Siaya County, Ugunja sub-county. So this is something that is already with us. There is no age predilection that is being propagated that the under 20s are not having this disease. It is cutting across all ages, so we should all be careful.
Well, to those who don't know about this disease, could you at least briefly expound on it? What is coronavirus, or as they say, COVID-19?
Now, when it started, it was being called coronavirus. Then WHO sat down and gave it the name COVID-19. It is currently being called COVID-19. The first case was diagnosed in Wuhan, China. It has spread sporadically. It is now world over. The effect is even more in Italy. Fortunately, it is being contained well in China, but it is now a new thing in Kenya and East Africa. Our government is working hard, and we should trust the government, and we should also do what the government is telling us to do. Let us be self-quarantined. Thank you.
Okay, and what are the signs of this particular infection?
Yeah, these signs vary. But the most common sign is sneezing, coughing, chest tightness. When you can even have headaches. Yeah, these signs vary in strength. Yeah, according to your immunity level. Yeah, the stronger your immunity, the lower the chances of these signs being seen. For a low immunity person, yeah, the elderly, people who have diseases like respiratory diseases, if you are HIV positive or you are on care, these signs may be more pronounced. So when you get even mild symptoms or even none sometimes, and you are in contact with people who are testing positive, yeah, you should ensure you go to a testing center so that you can be tested and you save the others.
What are the precautions the public can take to avoid the spread of this newly discovered infection?
Yeah, remember, all of us are being led by a government, and the government always means well for its people. Now, when the government comes up with precautions, we should and we must adhere to them. The first one was to avoid crowded areas. The second one was to do hand washing with soap or a hand sanitizer. We believe soap and water is even better, so you don't have to go out there and panic buying the hand sanitizers. The other thing is we should try, and when we are coughing, we use the elbow to cover our noses, yeah, and mouth, yeah, because it is proven that this thing can really spread through droplet infection. However, as early as in the morning today, we also got the information that it could be airborne. So we have also to ensure that we maintain the safe distance and, if possible, self-quarantine. If your job does not need you to work in the office, then try to work at home. Even in the most important sectors like the judiciary, we are taking these precautions. So I don't know why the other people should not take these precautions.
Well, some people might be wondering, why is it essential for them to wash their hands?
Yeah. When the virus is funny, its composition is funny. Now we have to think about killing the virus. It has a component, a wall-like component. Now this wall-like component can only be broken down by soap. And now if you use soap which disintegrates this wall for the virus, then the wall is broken down and the bacteria, the virus will die. But if you just wash your hands without soap, then you are doing nothing. If you also use something like the alcohol-based hand sanitizer, this is also going to help in breaking down the virus wall, yeah? Then you are going to kill the virus. If you are just going to do this basic thing of hand washing, then you are going to break the cycle of transmission, so that even if you have the droplets, you are not going to end up having the virus.
And also, we've witnessed some of the residents in town wear a mask. At what time should a person wear a mask, or how effective is the mask?
The mask is effective, yes, but we are trying to avoid people wearing masks. One, it causes unnecessary tension. We have to understand that when you wear a mask, you are causing unnecessary tension. Number two, everybody should not wear a mask. Only those who have been tested positive and are trying to protect themselves from spreading the virus to other people, yeah? These are the only people who are allowed to wear masks. And the healthcare providers, because these are people who are contacting many people. But if you are walking in town and you are wearing a mask, you have not reached that level.
Supermarkets are offering hand sanitizers, water and soap to customers to wash their hands. Some of the area residents are also wearing masks to protect themselves and others against the new coronavirus. Why are you wearing masks, and what is the importance of wearing masks?
We are wearing masks because of protection against this new disease, coronavirus disease.
Among the hardest hit sector by this pandemic in Kisumu is the business sector. Most of the businesses have closed down and ceased operation, while those who are still operating have observed a reduction in customers. Transport sectors have been disrupted by this pandemic. Boda operators record a low turnout. To them, working from home is difficult because their job requires them to be on site.
Kutoka nje ama kutokushirikiana na mwingine pamoja ni sawa, ni hali ya kiafya, lakini tunadhoofika ama tunaumia katika hali ya biashara. Biashara imeenda vibaya.
The government implementation of quarantine and stay-at-home orders have paralyzed learning. Schools within Kisumu County have closed down to comply with this directive. Every loss of life as a result of COVID-19 is a tragedy, but it also motivates the entire nation to double up and do everything we can to stop the spread and save lives. Wuhan has reported no case for the first time since the virus started. Wuhan provides hope to us and that even more severe situations can be turned around. Protect yourself and others from infection by washing your hands with water and soap or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spread primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it is important that you practice respiratory hygiene. For example, coughing in a flexed elbow. Brian Ochieng reporting from Kisumu.